All right. Welcome, everyone. Thank you so much for joining today's briefing. Just a couple of logistical notes before we get started. Participants have been muted just to keep things streamlined, but we would love your engagement and your questions. So to ask questions, there's a Q&A box at the top of the Microsoft Teams webinar. Please use the Q&A function to ask questions as they come up throughout the presentation, and we'll get to those at the end. Just a reminder that this event is closed to press. It is just for our partners in the environmental and health and policy spaces. And we really appreciate your interest and participation in all of your incredible work. With that, I will turn it over to Laura Kate Bender, who is our Assistant Vice President for Nationwide Healthy Air. Laura Kate, take it away.
Thanks, Diana. Hi, everyone. Thank you so much for being here today. As Diana said, I'm Laura Kate Bender, Assistant Vice President for Nationwide Healthy Air here at the Lung Association. And welcome to our briefing for our partners working in the health and environmental communities on our newest report, Something in the Air, Nitrogen Dioxide, and Community Health. We just released this a couple weeks ago, and we're excited to share the results with you. I will acknowledge at the top the very tough reality that all of us who care about clean air are working in right now and living in. I will not list them here, but the assaults on clean air protections, on EPA's staff, programs, and funding are, of course, profound, and I'm sure very much top of mind for all of us right now. And of course, this isn't just limited to EPA. We know that there are threats across a lot of things that all of us care deeply about. So let me just say at the top how much we appreciate you. Speaking for myself, it means so much to know that we're in community with all of you, and that we have your knowledge, expertise, and resources, and we want to be as useful as we possibly can in this time. So in the context of this report, here's what that means. We know that we both need to be able to respond to attacks on clean air protections at the same time as we're laying the groundwork for those protections to be made better in the future. So as you'll hear us highlight today, this report can do both. In terms of pushback, you can use it as one more proof point among many that pollution is harmful to people's health, in this case, nitrogen dioxide, that many communities have levels that are higher than others and can put their health at risk, that we need to be able to monitor this pollutant, and that we need to invest in the science to help even better understand this pollutant and who it affects. We also hope that this report can lay the groundwork for the future for stronger standards to limit oxides of nitrogen when conditions are better to clean up. So what you'll hear today is the context for this report, where it fits among the Lung Association's air quality reports, health information on the impacts of NO2, our methodology, what we found, what calls to action we include in the report itself, and then other calls to actions that we think might be helpful to use this report to bolster. Please don't hesitate to reach out to us. Obviously, ask questions on today's webinar, but also if you have thoughts after, we always want our reports to be useful to you, and we really value feedback that we get from you on how we can best do that. Again, thank you for joining us today. Thank you so much for the work that you do. And with that, I will turn it over to the lead author of our report, Lexi Popovich.
Hi, everyone. Thank you again for joining us today. Like Laura Kate said, my name is Lexi Popovich, and I am a Senior Manager of Nationwide Policy and lead author of our Something in the Air series. So what is our Something in the Air series? Something in the Air was created as a supplemental report to our annual State of the Air report. While State of the Air has long served as a trusted resource on air pollution, tracking national trends in ozone and particle pollution, some counties do remain unmonitored. This leaves communities without vital air quality data. To help close these gaps, the Something in the Air series explores how emerging technologies, such as satellite data, can expand our understanding of pollution exposure in under-monitored regions. By leveraging these tools to complement regulatory monitors, we can better identify pollution hotspots, strengthen research, inform policy decisions, and support advocacy for more comprehensive clean air protections. This ensures that all communities, especially those at risk, have the information they need to fight for cleaner and healthier air. Our first installment of the Something in the Air series we released in October of 2024, and this explored how satellite technology can uncover PM 2.5 pollution hotspots and fill those critical gaps in unmonitored counties. By analyzing satellite-derived data, the report identified 6 spotlight counties, including Collin, Texas, Forsyth, Georgia, Marion, Oregon, Mojave, Arizona, St. Charles, Missouri, and St. Tammany Parish, Louisiana. Those all ranked among the most polluted 2% of unmonitored areas in the US from years 2020 to 2022. These report findings highlight the urgent need for expanded air quality assessments tools and greater access to pollution data. And as mentioned, our recent report that was just released is called Nitrogen Dioxide and Community Health. And we'll be talking about that today and how it explores satellite data to provide a more detailed analysis of NO2 pollution at the community level. By examining localized variations, the report offers deeper insights into NO2's public health impacts and the disparities in exposure that disproportionately affect vulnerable communities. This is the Lung Association's first report dedicated to nitrogen dioxide, and it highlights how communities of color often bear the heavier burden of pollution. These findings reinforce the urgent need for stronger air quality protections, as Laura Kate mentioned, and various targeted interventions. The report provides a comprehensive look at NO2 pollution, starting with an introduction to its sources, how it forms, and its health effects. It then examines existing NO2 monitoring and regulations, highlighting gaps in coverage in areas where improvements are needed. The report also explores disparities in NO2 exposure. Based on the findings, we outline key recommendations for action to strengthen monitoring, reduce pollution, and protect public health. The report then concludes with references in an appendix detailing the methodology and acknowledgement sections. All right, now we will jump into the report background. So why nitrogen dioxide? Nitrogen dioxide is one of 6 pollutants regulated under the National Ambient Air Quality Standards, or the NAAQS, yet it remains largely under-researched, under-monitored, and under-regulated. Despite its well-documented health risks, it has not received the same level of attention in public messaging or regulatory action as other pollutants. Existing monitoring networks fail to capture NO2 pollution patterns, leaving those critical data gaps to obscure the true extent of exposure. These gaps contribute to localized pollution that most impact overburdened communities already facing significant environmental and health challenges. Recognizing the impact of NO2 is the first step in strengthening monitoring efforts, improving air quality, and addressing the health burdens it places on vulnerable populations. And with that, I will pass it to Shamala to discuss NO2 and its health impacts.
Thanks, Lexi. So nitrogen dioxide, as the name suggests, it's made up of the 2 most abundant gases in the atmosphere. It has a pungent odor, it's corrosive, and it's a highly reactive oxidizing agent. It also happens to be the most prevalent member of the group of nitrogen oxides, which are all of which are highly reactive. And that group includes nitric oxide, which together with NO2 is often referred to as NOx, NOx. So sometimes you see NO2 and NOx used interchangeably, but NOx is NO2 plus NO. And the reason why NO2 and NO are corrosive gases are because when they contact with moisture, they form acids, nitric acid and nitrous acid. One important point is because they are highly reactive, their atmospheric for both NO and NO2, and as we're talking about NO, one other thing I need to mention is in the previous slide, Lexi talked about nitrogen dioxide being regulated as for which EPA sets the National Ambient Air Quality Standards. NO2 happens to be a stand-in and a representative of the group of nitrogen oxides because it's relatively more stable. But it has a very short atmospheric residence time. Its half-life in atmosphere is small, from minutes to hours. You find higher concentrations of NO2 near its emission sources, both stationary and mobile sources, such as roadways, industrial centers, and smaller groups of area sources. So it's, in a way, it's considered a fence line pollutant, affecting communities that live close to the sources. Because of its high reactivity and rapid chemical reactions in the atmosphere, it shows a lot of fluctuation, spatio-temporal fluctuation as you move away from the source, and with time, it shows variability in its levels. Next, please. So NO2 has been associated with or causes a range of morbidities and even premature mortality. So there's essentially no organ that has, or no biological system that has been spared. Science shows that it affects respiratory system, cardiovascular, metabolic issues, causes reproductive issues, developmental, neurological. And it also causes weakened immunity, so that exposed folks are more prone to infections. And also it worsens the chronic diseases that people may be suffering from. Is also linked to autoimmune diseases and cancer, and as I mentioned, premature mortality. And there are specific groups which we'll talk about in later slides that are more vulnerable to NO2 exposures, and they include children, elderly, and individuals with pre-existing health conditions, and folks that work or play outdoors. Next, please. So, as with any pollutant, the impacts of NO2 depend on the concentration of exposure and also the duration of exposure. For short-term exposure, from anywhere from minutes to a month of NO2 exposure, results in a whole host of respiratory issues: irritation of eyes, increased inflammation of airways, worsened cough and wheezing, reduced lung function, worsening asthma symptoms, increased attacks of asthma, increased bronchial reactivity, greater likelihood of ending up in the hospital, emergency room visits, cardiovascular disease, and all-cause deaths. And for long-term exposure, which is over a month to years of exposure to NO2, causes acute infections of the airways, incidence of asthma, nervous system development disorders in children, incidence of COPD, onset and progress of respiratory and cardiovascular diseases, and incidence of diabetes and cancer and all-cause deaths.
Thank you, Shamala. And expanding off what Shamala just mentioned, we will dive deeper into who bears the burden of NO2. When we talk about NO2 exposure, certain groups face significantly higher health risks. People with pre-existing health conditions are especially vulnerable, as NO2 can worsen symptoms and trigger complications. These health effects are even more severe for overburdened communities, where multiple risk factors compound the impact of air pollution. These risks are not evenly distributed. Low-income populations and communities of color are more likely to live in areas with high levels of NO2, ozone, and particulate matter, often near major roadways and industrial sites, like Shamala mentioned, and putting them at greater risk for cardiovascular and respiratory diseases. Marginalized communities experience disproportionately high rates of chronic illnesses, driven by greater health needs and compounded by demographic, economic, social, and environmental challenges, which further deepen these disparities, making it even harder to escape the cycle of pollution-related health impacts. Income, race, and pollution amplify these health risks, and when NO2 pollution is combined with poverty, inadequate healthcare access, and other social stressors, health outcomes do worsen. So recognizing who is most affected is critical to advancing equitable solutions. As we dive into the findings from this report, I'll be discussing a few key research studies that help shape the focus of the report and set the tone for understanding NO2 pollution disparities. So research shows that NO2 exposure is not evenly distributed across racial and socioeconomic lines. Black, Hispanic, Asian, and multiracial populations in the US are exposed to NO2 levels 15 to 50% higher than the national average, while non-Hispanic white populations experience 5 to 15% lower levels. The COVID-19 pandemic further revealed some of these disparities, despite overall reductions in pollution, communities with greater racial diversity and lower income still face disproportionately higher NO2 levels. In fact, data showed that NO2 levels in marginalized communities were nearly 3 times higher than in predominantly white areas. Adding to this inequity, communities of color have significantly fewer NO2 monitors, which means pollution exposure and its health risks may be underestimated. So Shama mentioned a few sources of NO2. The largest source of NO2 pollution comes from transportation, including trucks, buses, and cars. Burning fossil fuels like coal, oil, methane gas, and diesel also release significant emissions. Industrial activities such as oil and gas production, power plants, industrial boilers, and combustion processes further contribute to pollution. Indoors, sources like gas stoves, wood-burning stoves, kerosene heaters, dryers, and space heaters can produce harmful levels of NO2. Wildfires also release NO2, adding to both regional and local air quality concerns. And we did mention fence lines, but diving deeper into that, as we recognize the sources of NO2, it's important to note that pollution is the strongest at the fence line and near these emission sources, such as heavy traffic roadways and industrial sites. Given its high reactivity, again, that we mentioned previously, NO2 levels can transform quite quickly and decrease sharply with distance. Near source pollution disproportionately harms low-income communities and people of color who are more likely to experience the first impacts of pollution and the worst impacts, putting those who live closest at the greatest risk while also worsening health disparities. NO2 concentrations near major roadways can be 2 to 3 times higher than surrounding areas, putting commuters, traffic workers, and nearby residents at greater risk. A NASA study identified that in the US, nearly 150,000 warehouses contributed to high NO2 levels, many of which were located in vulnerable communities. More than 45 million people live within 300 feet of a major transportation infrastructure, facing continuous exposure to elevated NO2 pollution as well. NO2 plays a critical role in the formation of secondary pollutants that contribute to ongoing air quality and health concerns. Once emitted, NO2 undergoes rapid chemical reactions in the atmosphere, interacting with volatile organic compounds and sunlight to produce ozone, which is a major air pollutant. NO2 also contributes to the formation of nitrate, a type of fine particulate matter linked to respiratory disease. Secondary pollutants pose significant health risks that current regulations do not fully address. While NO2 is nearly invisible under normal conditions, at high concentrations, it takes on a reddish-brown tint, making pollution more noticeable in heavily impacted areas. When combined with the light scattering effects of fine particle pollution, it contributes to the characteristic haze and smog seen in regions like California. So therefore, controlling NO2 actually provides a triple benefit to public health. That includes reducing NO2 exposure, lowering ozone formation, and decreasing PM2.5 levels. So how is NO2 regulated? The EPA regulates NO2 under the National Ambient Air Quality Standards, which sets the limits on acceptable pollution levels. To determine whether these standards should be updated, the EPA conducts a scientific review process that includes health assessments, risk analyses, and exposure studies. Under the Clean Air Act, these reviews must occur every 5 years to ensure they reflect the latest scientific understanding. In 2016, the EPA's Integrated Science Assessment for Oxides of Nitrogen further reinforced the link between NO2 exposure and serious health impacts, including respiratory diseases, cardiovascular conditions, and increased mortality. These findings continue to shape discussions on whether stronger air quality protections are needed. So as mentioned, NO2 standards are reviewed every 5 years. As part of the current review process, public comments were collected in late 2024 to help determine whether updates to the standards are needed. The NO2 NOx were first established in 1971, setting the annual limit to 53 parts per billion, a threshold that has continued to remain unchanged for 50 years. In 2010, the EPA introduced the 1 hour standard that you can see here on the screen to the left, of 100 parts per billion, which is designed to address short-term exposure risk and capture peak NO2 pollution levels more effectively. So these standards do play a crucial role in protecting public health, but as new research continues to emerge and findings that we see in this report, it remains to be said, are these standards strong enough to safeguard communities from NO2 pollution? So as you can see here on the screen, this is a NO2 standards comparison. So you can see the NO2 standards set by the World Health Organization and Canada. It's important to note that the World Health Organization guidelines are just recommendations, while Canada's standards, like those in the US, are health-based regulations. Canada currently has stricter NO2 standards than the US, with the 1 hour standard of 60 ppb and an annual standard of 17 ppb. However, these limits are set to become more stringent in 2025, which will lower the annual standard to 12 ppb and the 1 hour standard to 42 ppb. If the US adopted Canada's upcoming annual standard, nearly 25% of monitored US counties based on 2022 design values would fail to meet it. And we will revisit this in our recommendations, but this comparison reinforces our key messages that NO2 does remain underregulated, undermonitored, and under-researched in the US. So now we will look at the monitoring network. I know there's a lot of words on the screen, but focusing on just some of the coverage and what that means on the far right side. So although there are 482 monitoring sites across the US from the 2021 to 2023 years, so you can see that on the screen there. So oversight of NO2 monitoring is managed by the EPA, and it is in collaboration with state, tribal, and local air agencies. Monitors are placed according to the NAAQS guidelines and are included in state and tribal implementation plans to ensure compliance and public health protection. So as you can see under key networks in the middle, state and local air monitoring stations, or SLAMs, account for 80% of sites in the 2023 year. Within SLAMs, NCORE and PAM stations contribute to 76 sites. Below that, you have near road monitors located in metro areas with populations over 1 million, which capture traffic-related NO2 pollution, and that is 73 sites. Special purpose monitors, or SPMs, are used for short-term studies rather than long-term regulatory compliance and have 71 sites in operation. And then below that, you have tribal air monitoring stations, or TAMs, operated by tribal governments to provide air quality data specifically for tribal lands, and that is 13 sites. So this here is a map of NO2 monitoring sites reporting data to the EPA during the 2021 and 2023 period. It is important to note the distinction between the monitoring data we will go on to describe in the report versus the information displayed on this map. This is the 2023 map, which again shows the 482 NO2 monitoring sites. However, the majority of the data that we are using in our report come from the 2020 to 2022 reporting years. If this was the 2022 monitoring site map, it would show 481 monitors as opposed to 482, which is not much of a difference from those 2 years. So this map shows the distribution of NO2 monitoring sites across the US in 2022, categorized by the recorded design values in parts per billion for years 2020 to 2022. In 2022, it was reported that all monitoring sites across the US recorded NO2 levels below the NAAQS. So you can see below on the map, 289 sites reported levels between 0 and 10 ppb, 105 sites reported levels between 11 and 20 ppb, and then you have 8 sites that reported levels between 21 and 30 ppb. So what's the problem here? We're seeing compliance with the numbers and the standards, and there's been significant progress over the past 50 years. The Clean Air Act itself has driven significant progress in reducing pollution through cleaner vehicles, fuels, emission standards, and industrial controls. These policies have led to multi-pollutant benefits, lowering levels of NO2, ozone, and particulate matter. NASA's ozone monitoring instrument shows a 20 to 50% decrease in NO2 concentrations across the US from 2005 to 2022. This decline is largely due to state and federal regulations that have reduced NOx emissions from power plants and vehicles. Additionally, over the past several years, as mentioned, all NO2 monitoring sites in the US have consistently met the NAAQS for the annual NO2 standard. So although there is broad compliance with the NO2 standards, and again, progress over time that's significant that we had just mentioned, it's important to examine whether current monitoring and standards fully capture the real world pollution exposure, especially for overburdened communities. So decades of emission control standards, such as vehicle regulations and industrial pollution reductions, have contributed to declining NO2 levels at monitoring sites. However, limited monitoring near major emission sources remains a persistent challenge, leaving these pollution hotspots near major roads and sites overlooked. With NO2's short-lived nature, that makes it more difficult to measure peak pollution levels, meaning these communities that are experiencing pollution spikes throughout the day may still be classified as compliant under current standards. Again, as mentioned, NO2 does play a role in forming secondary pollutants, which not only pose a serious health risk, but they also are not factored into NO2 compliance assessments. Air quality monitors are often disproportionately placed in predominantly white neighborhoods, again, leaving many communities of color with less monitoring coverage. So how do we overcome this problem? We analyze and utilize satellite data for this report to help gain information and advocacy support for continuing our efforts to increase clean air protections for all Americans. Satellites play a crucial role in measuring NO2 by capturing its total concentration in a vertical column of air from the Earth's surface to the upper atmosphere. And unlike ground-based monitors that measure pollution only at the surface, satellite data provides a broader view of this NO2 distribution. To make this data more applicable to human exposure, there's computer modeling used to estimate surface level pollution and translate those column measurements into a more localized perspective. Because satellite data is widely used as an air quality metric and a key indicator of nitrogen oxides, it helps researchers and policymakers better understand these pollution patterns. And most importantly, it provides a broader spatial coverage, enhancing our ability to track pollution patterns and fill in those monitoring gaps that we have mentioned. So for NO2, there are two key satellite instruments that are used. On the left, you can see TEMPO, and on the right, TRPOMI. TEMPO is a geostationary satellite that captures hourly daytime NO2 levels across North America. And TRPOMI uses spectrometry to analyze pollutant absorption patterns in the atmosphere, helping to detect pollution trends over time. And so while these satellites do not measure nighttime air quality, TEMPO does actually measure and detect light pollution. But it's specific to note that for this report, we are only using satellite data from TRPOMI that is providing a more high resolution measurement for NO2. All right, and we will jump to our findings. So the map that you can see here on the screen displays NO2 pollution rankings based on satellite data from 2020 to 2022. Each category represents a distinct percentile range rather than a cumulative total. So for example, the dirtiest 2% that you can see in the legend includes NO2 values between the 98th and 99th percentile, while the dirtiest 1% only includes areas at or above the 99th percentile. Similarly, the dirtiest 5% covers values from the 95th to 98th percentile, ensuring there is no overlap between these pollution categories. So this map, you can see, the dark purple and blue areas are mainly showing the predominant urban nature of NO2 pollution, where a lot of these affected regions are concentrated in densely populated metro areas, particularly along the coast and urban corridors of California, Illinois, New York, New Jersey. You can see up in Michigan and in Washington. Among the 50 counties with the highest satellite detected NO2 levels, the total population exceeds 28 million, with a median county population of 475,000 people. So these are big cities and affecting a lot of people in them. Additionally, numerous communities across the Midwest and South and Mountain West that you can see on the map rank within the dirtiest 25%, which also emphasizes that NO2 pollution is not just a big city or a metro problem. And it kind of underscores the nationwide scope of the issue and reaffirms why we are using satellite data to identify these pollution trends, especially in areas with limited monitoring. So unlike our first report, which focused on county level data, this report highlights, again, the importance of the community-based NO2 analysis at the intra-county level. So county level data provides a broad picture of NO2 pollution trends, but often misses critical neighborhood level differences. Within a single county, air quality can dramatically change due to factors like traffic density, industrial activity, or demographic composure. As a result, broad county averages can obscure pollution hotspots and communities most affected by the high levels of NO2. A 2022 study found that the state and county data underestimated racial and ethnic exposure disparities by 20% compared to finer scale analyses. This highlights the need for more localized assessments as an inter-county analysis continues to uncover these disparities by looking at that finer geographic scale. NO2 hotspots tend to emerge where emission sources, pollution demographics, and air quality intersect, revealing significant inequalities in exposure. Pollution does not exist in isolation, so addressing these cumulative impacts alongside community vulnerability is essential to understanding the full burden of NO2 exposure. So here we can see on the map, this is NO2 exposure disparities. This is a dot plot that we did use in the report. The horizontal axis represents NO2 exposure levels relative to each county's population average, ranging from lower to higher exposure. Blue dots indicate NO2 exposure levels for people of color, while white dots represent exposure levels for non-Hispanic white populations. It's important to note that the 13 counties shown are among the 25 most polluted for NO2, both on satellite and regulatory monitoring data, except for Essex County, New Jersey, where they do not have a ground level monitor. So these counties are located in major metropolitan areas with high traffic density and in some cases industrial activity, which can both contribute to significant pollution. And communities with a high percentage of people of color are experiencing higher exposure levels. As you can see, most of the blue dots are leaning towards the higher side as compared to the white dots on the left side of the map. So this, again, reaffirms integrating satellite and ground-based data to provide a more complete picture of our NO2 pollution patterns across the US. And combining these data sources improves accuracy and strengthens our understanding of disparities overall. So this map is a graphic that we used in our report. It is highlighting the 4 counties that we take an intra-county look into to better understand how these pollution exposure intersects with demographic disparities. This analysis continues to examine NO2 concentrations at the census tract level. So you can see here we are looking into Maricopa County, Arizona, Orange County, California, Essex County, New Jersey, and Cook County, Illinois. And these were selected as examples due to their high relative NO2 exposure disparities. These counties also rank among the 25 most polluted based on both satellite and monitoring data, again, except for Essex. So these were on the dot plot from the previous slide. So first we have Maricopa County, Arizona. And so this map provides a side-by-side analysis of NO2 pollution and demographic patterns. And so we can see a closer look at how pollution is unevenly distributed within each county. And so each county has 2 maps. The left map will display NO2 concentrations and have a color gradient from light yellow to deep red that you can see there. And again, that represents NO2 concentrations. And the right map will be percentage of population who are people of color, using a gradient from pale green to dark blue. Just to note that NO2 data in this map is measured by column density, as you can see on the left map, rather than parts per billion, which is what monitoring sites would reveal. So again, you can see how you would overlap these maps where the dark blue and the dark red can coincide with sources in your higher populations of people of color. We move to our second county, which is Orange County, California. You can see there's a larger red gradient on the left map showing high levels of NO2 concentrations, and then comparing that to where it would overlap on the right map with the demographics of people of color, seeing where that dark blue and the red are correlated, and how that could refer to NO2 exposure in communities of color. And we move on to Essex County. Again, there's no ground monitors for Essex County. So this is, we're just using satellite data. So you can see again the gradient of color on the NO2 concentrations with a higher concentrations toward the right side of the county. And then you look to the percentage people of color by census tract, and you can see that falls within 80 to 100% of the population is people of color in that area that also overlaps with the dark red. And our last county is Cook County, Illinois. We can again see where the colors are overlapping and the distribution of NO2 and percent people of color. And some areas of NO2 could be higher with and have lower proportions of people of color, and some communities of color do not experience high levels of NO2. And on this map, you can see there's a high percentage of people of color at the lower end of the county, and sometimes that doesn't match up to the high levels of NO2, but overall, if you overlap them, again, people of color are more likely to live near these emission sources where NO2 concentrations are the highest. And just an inter-county analysis recap from the report and the maps. So again, satellite data reveals that white populations generally experience lower air pollution exposure, while people of color face significantly higher NO2 levels, even within the same county. So the existing monitoring network provides less coverage in high exposure communities, potentially, again, underestimating the true extent of pollution. So not only do satellites provide that inter-county analysis with high resolution insights, but they also are filling in those gaps that we've been mentioning, especially in pollution clusters near high traffic urban corridors and near source regions. So again, the maps reinforce the link between pollution, vulnerability, and health risks in low-income communities where burdens are often the highest. So redefining how NO2 is measured across smaller geographic areas, this technology allows us to come up with more data-driven interventions to support policy change and advocacy. So with that, I will pass our policy recommendations on to Liz.
Hi, everyone. Glad to be with you today. So let's talk advocacy for this report. So it goes without saying that if we are saying in this report that NO2 needs to be better researched and better monitored and better regulated, then that's going to be what we're calling for in our advocacy asks. So we need to see NO2 research prioritized. We need to see the health impacts of this pollutant research, but also how this pollutant interacts with others and the cumulative health impacts of multiple exposures. Methodologies for these cumulative risk assessments should incorporate chemical pollutants, stressors like climate change, and socioeconomic disparities, and an improvement in data granularity to get at some finer geographic scales. So in other words, we need to investigate what the real world local impacts of NO2 are, especially for populations that are traditionally more vulnerable to the health impacts of pollution, like people of color and those who are living in low income, disinvested communities. And then we need to better monitor NO2. There should be priorities, of course, placed on high-risk regions where there are known population clusters, and we need to do a better job at getting localized data in real-world conditions. We know that there are gaps in federal monitoring structure. That's kind of what Lexi all just went through. And in order to fill them, we need to have more federal investment in air quality management. And so while we are working towards that, and even when we achieve that, we have to use all of the tools that are in our toolbox, which includes leveraging satellite data to supplement that ground-based monitoring. And then lastly, we need to better regulate NO2. The Lung Association has been calling for years for a better standard, and there is actually some consent decrees ordering that EPA finalize a rule on NO2 NACs. It will be our jobs as stakeholders and advocates to continue to hold EPA accountable for what the law requires, which is to set standards that protect health. Which is why the first two slides of the advocacy that I went through feed directly into better regulations. If we have more and better data, and we have more and better developed research methodologies that incorporate those real world, localized cumulative risk, we can advocate for stricter standards. Now, having said that, as Laura Kate alluded to earlier, the current EPA has already displayed an unwillingness to follow the science and is actively working to deregulate the sources, many of the sources that emit NO2. So we are certainly not under the impression that we will see action on NO2. If we do, it wouldn't be good, I don't presume. But the value, again, that we have in advocates is in holding our decision makers accountable to follow the science, follow the law, and then raising hell when that doesn't happen. So I'm sure you all know by now, as Laura Kate said, the many actions EPA listed last week, and that they intend to roll back health protections from pollution from various sectors. We hope that all of you can use this report to highlight the health harms of NO2 and the disparities in its impact at each of these sort of announcements that we see, including those that would reduce enforcement on these sectors. And then lastly, we know that the very institution of EPA and really across the federal government is under threat with layoffs, funding freezes, eliminations of offices. Just last week, I think it was just last week, announced that EPA plans to gut the Office of Research and Development, which would run directly contrary to all of the deficiencies that we highlighted in this report. So it is absolutely crucial that while we are responding to sort of the whack-a-mole of rollbacks of this or that regulation, that we support overall funding over at EPA, their staff and their work, and not just EPA, at NASA and other agencies that serve a purpose in educating people about the air that they breathe and taking steps to protect them from dirty air. So we know that this advocacy that we have coming up is very much long-term, and we hope that this report can be added to your advocacy toolbox. And so please do reach out to us, reach out to me if there are ways that you think we can collaborate on doing that. Thanks so much.
Thank you, Liz. So just a note on future reports. So future installments of the Something in the Air series, we will focus on solutions that are using emerging technologies such as satellites and community sensors. So we're looking to, again, continue closing air quality gaps, but utilizing interviews with grassroots organizations or environmental justice advocates that are leading air quality action on the ground. So through these case studies, we hope to continue highlighting community-driven efforts and, like Liz said, push for stronger air quality protections and expand access to cleaner and healthier air for all.
Thanks so much, Lexi, and everyone. So just another reminder. Oh, sorry, didn't mean to cut you off, Lexi.
Oh, no, you're good. I was just moving aside, so.
Thank you. So just a reminder, if you have any questions you'd like to ask, to enter them into the Q&A tool. And I see one question from Pete Chipman. I can't see your affiliation from the screen, sorry. But any insights as to why there are only 14 monitoring stations for tribal nations? And are they all or mostly in the Southwest?
I don't have a great answer for that. I don't know if anyone else on the team does, but I will say we're potentially looking at for the case studies, utilizing looking at community sensors and what tribal nations are doing on the ground level to kind of make up their own gaps with some of the lack of monitoring that they have. But I don't know if anyone else on the team had a better idea of that.
I wonder if, oh, go ahead, Catherine.
I was just going to say, Lexi, if you want to go back to the slide that shows the placement of the monitors, you might be able to see at least where they are. It's my understanding that the tribes have their own, obviously have their, as sovereign nations, they have their own agreements with EPA about how they monitor. It's hard to see.
So yeah, Utah.
Yep. Yeah, those upside down triangles, right? Mm-hmm. So Four Corners, Utah. So looks that way, yes.
And I'd also like to say, although we don't have, the most granular information on that right now, our friends at the National Tribal Air Association put out a state of tribal air, the status of tribal air report regularly. And I put a link to that in a comment responding to that question. I know that report has more information on monitors and the need for more monitoring in tribal nations. Thank you for the question. Any other questions? And thank you, Pete, for the comment. Great to see your email. Any other questions? I guess we'll just, open it up to speakers and say, what were there any? Let me this. There we go. Just responded to your question, Pete. Hopefully, you get that link. Were there any findings that were surprising, particularly surprising in the report details? I'll ask Lexi and Catherine.
Particularly surprising, not quite. I think, we're hoping, with the research and with studies that show, communities of color are more at risk for pollution across the board. We more so we're looking how satellite data could really amplify that. And it did, and just reaffirming, a different way to look at least for the Lung Association, and closing those gaps and being able to talk about NO2, since the state of the air doesn't talk about NO2. So we're glad that it amplified what we've already read in studies and our research and other studies that are happening around the country as well.
Yeah, I don't have anything to add to that. I think, as Lexi said, we knowing the nature of NO2 and the nature of fence line and roadway communities, we assumed we would see some disparities, and it has been shown in the literature, but then to get the satellite data to really strongly confirm that the presence of those disparities was gratifying and gives us more meat to work with.
Thank you. I see another question that's rather technical. So how well do satellite and NO2 estimates approximate actual values? Or in other words, what are the limitations with satellite measurements compared to the FRM or FEM measurements, which are the gold standard?
Yeah, so I wish we had Kevin on. He's our more tech guy with more of those answers. I think, there's definitely limitations with satellites across the board with, whatever pollutant that we're looking at, because you're taking that column and trying to use algorithms and other technical things to convert it into a ground level assessment. So, they also aren't measuring at night, but we see, with peak and fence lines, it's a lot of morning and evening. But yeah, there's always limitations. I think the science is continuing to expand, and our work with people through NASA and some of our other partners are continuing to make those processes better and more efficient, so we can continuing to trust that science through the satellites as well. Yeah, I don't know, Catherine, if you wanted to add.
I think the researchers that are working with NO2 satellite data are, I think, are pretty comfortable with the it's not direct equivalency to ground levels, and there is no equivalency. You know, we were not given a formula that we could use to convert the the atmospheric column data to design values from monitors. So that that doesn't exist, and that would require a lot of computer modeling, as was done with the PM data that we used in our first report. But taking that value for what it is, knowing that it's column data, it is the whole column. There is, it is internally consistent, I guess you could say, a reflection of the gradation from more exposed to less exposed on the ground. Hope that makes sense.
Thank you. And a follow-up question, are there personal monitors for NO2? Thinking about PM 2.5 and purple air monitors, are there a lot of purple air type monitors analogous for NO2 for community work? It's a great question.
Yeah, that's a great question. Not that we've looked too far into, most of that is just PM 2.5 with the purple air and less with NO2. So I think PM is more of the target for those community sensors. And, we're looking into, again, doing our case studies with community sensors and looking at PM specifically. But, hopefully in that research, we'll see what future science or future sensors could be covering NO2 and what that looks like, or if, that's already underway.
Thank you. Anything to add on that to the other speaker? All right. Thank you so much for that point. And I guess we'll just say, in the final minutes, Laura, Kate, and Liz, we'll just, I would love to hear if you have any thoughts about the highest level, most pressing ways that people can jump in on the advocacy side if they are interested in doing something on these issues. I know, Liz, you went through recommendations, but any final thoughts in the last minutes on most important things that people can be doing on these topics?
I can
Sorry, go ahead, okay.
I think calling on Congress is really helpful right now. I think it's clear that the current EPA leadership is not particularly interested in hearing about the need to clean up more pollution at the moment. And certainly this report can be part of the broader pushback that I know all of us are doing on the EPA rollbacks that were announced as planned last week. But having members of Congress understand that their constituents are being impacted by this pollutant is more important now than ever. So that is my ask.
I'll just elaborate a little more now that I know where my mute button is. Yes, Congress is still a very helpful audience, because even if the administration is not listening to them either, at least they have a bigger platform to be able to, as I said, raise hell about all of this. And I also think it's a good reminder, and I'm reminded every time I go and meet with members of Congress, even those that are champions on the Hill. Everyone here, certainly at the Lung Association, the staff on this call, and then those who are our partners who are joining us, we live this every day. We are in the weeds with, the health impacts of these different pollutants, how the Clean Air Act treats these different pollutants, and how the implementation is supposed to go. And oftentimes I'm reminded that not everyone lives in the world that we live, and the terminology and the urgency that we feel, especially when it comes to some staff members of members of Congress. Many people know that there is always a ton of turnover that happens over on the Hill. And so education on the Clean Air Act, education on the health impacts of these pollutants, and why there needs to be action taken, is always very, very helpful. So I think, you know, meeting with Congress to have them, you know, be vocal on it, and also to help answer questions that they might have to make sure that when they are vocal, they are saying the right things.
I'll add one more thing at the more state and local level, that communities who know they're being disproportionately affected by multiple sources of combustion pollutants, including NO2, have need more information about the actual NO2 levels in their communities. And it is possible for air agencies to put in short-term research monitors, much less expensive than placing and maintaining regulatory monitors, but it's doable, and communities should be asking for that so that that information is being collected at the fence line, to give the air agency and the communities information about where cleanup is most needed.
Thank you all so much. Well, I will just say quickly that we really appreciate everyone on the line joining in, your interest in the report, the critical work that you all are doing. We're so grateful for it and grateful to be your partners. And we'll also just say our next big air related report, State of the Air, our big annual report, is coming out April 23rd. So stay tuned for that. And with that, I will wrap it. Thanks everyone so much.
Thank you.